Now, it's been 2.5 years since March 2020 when the COVID-19 pandemic really took hold of the United States. With the CDC reset announcement last week, as well as Dr. Anthony Fauci's upcoming retirement from the National Institute for Health, now is an appropriate time to reflect on the past 30 months in our nation's response to the pandemic. How much of what went wrong was simply reacting to the fog of war? What role did political calculations play? How can we do better next time? Joining me now to discuss this and all the latest COVID-19 news is Dr. Jay Bhattacharya, a professor of medicine at Stanford University. He's one of the authors of the Great Barrington Declaration, which advocated for an alternative approach to COVID-19 and was heavily criticized by Dr. Fauci himself. Dr. Bhattacharya, welcome back to the show.
Thanks for having me.
Good to see you again. You kind of dropped the bomb last time at the end of our conversation and talking about how many other people had died from the lockdowns. And I want to get there in a moment. But before we do, I want to kind of lay some foundation for where we stand right now with respect to COVID, because thankfully, mercifully, there are many fewer conversations. I think a lot of us have moved on with our lives. We're not thinking about this all the time. It's not top of mind, but it's still a thing. And Dr. Fauci, earlier today, during an interview with Bloomberg's David Weston, had this to say about the current state of the COVID pandemic. Let's play clip 4.
That I think we're really on the threshold of getting COVID to the point where it is at a level where it is low enough that we can actually not have it disrupt the social order. And it's not going to disappear, David. It's not going to be eradicated and it's not going to be eliminated. But I believe we can get it to a low enough level if we do the right thing. If people get vaccinated who are not vaccinated and those who are not boosted get boosted. I think that time is coming. I hope we get to that within the next few months.
Dr. Bhattacharya, do you agree with that assessment?
Well, I do think that COVID is at a point where we do not need to have it front and center in our mind for most people. But it's not because people need to do the right thing for it to happen. Case numbers will continue to be high forever. We have no technology from stopping the spread of this virus. It's just in some sense like a cold where we don't have a technology to stop it. Case numbers for colds are high. It's the coronavirus. It will spread around forever. And so looking at case numbers, I think if I understood that clip correctly, which Tony Fauci is saying is actually a misleading thing to be looking at. What we should be looking at is, does the disease still produce high risk of severe disease and death for a certain segment of the population? And I think with the vaccines and with the fact that such a large fraction of the population has already been infected and recovered, and thus have very good protection against reinfection and against severe disease on reinfection, we don't need to reorganize our societies around it. We should treat it just like we treat other severe or other infectious diseases. It produces severe disease in some people. Those people need protection. We should be developing better therapies for it. We should be developing better vaccines for it. We should not treat it as if it were a unique sui generis kind of virus that deserves fundamentally transforming society to defeat.
A quick correction, I misspoke. That clip that I played was actually from last Thursday, not from earlier today. I just wanted to make that clear. So in your estimation, is this situation with COVID ever going to be different than it is right now?
I mean, I think over time, people will become infected and recover more, probably multiple times in your life. With each infection and recovery, you will probably have better protection in terms of what would happen the subsequent time. It'll become eventually, for most people, a mild disease. For older people, it will still remain a threat, just as other coronaviruses remain a threat. For people with severe chronic conditions, it may remain a threat, especially for the older population. But it's the kind of threat that we cope with all the time, just because we're human, not something that's unique and different. I mean, it's not to say that it does. I just want to be clear. I don't mean to say that we should never think about it again. I think I very strongly support doing more research on COVID treatments, on better vaccines, and so on. But I do think that it should no longer ever again disrupt the lives of younger people, school children, and so on. That all of that did nothing really to protect them against the disease and disrupted their lives in ways that are really difficult to recover from.
Dr. Bhattacharya, what are your positions on the vaccines? Because they were emergency, rushed out. We had very little data on them. We've had some time to observe them now. Helpful for some, helpful for everybody, not helpful?
I think for the group that was the most helpful for were older people. Older people faced a high risk of death on COVID infection the first time they got COVID. Something, if you're over the age of 80, it was something like 5% infection fatality rate. If you had the vaccine on board, that divided that risk by 10. So it went from 1 in 20 to 1 in 200 or 1 in 400 risk of dying. I mean, it was definitely worthwhile and saved many lives for older people. At the same time, for younger people, I don't think it's unclear whether it saved very many lives. The COVID itself is a relatively small risk compared to other risks that young people face. And there were, especially for young men with the mRNA vaccines, a high risk of myocarditis, especially from Moderna and with the boosters. And so it's unclear that it saved very many lives among young people. The way this vaccine should have been rolled out is like how you roll out any medicine. You think about the benefits and the risks that are specific for each patient, and then make recommendations on the basis of that. I think this vaccine was a godsend in many ways. It saved the lives of many older people from the first time they met COVID. Same time, it's turned into this cultural touch point, which with mandates, people losing their jobs, vaccine-based discrimination. And I think that is all to be regretted. And it's something that I think public health needs to apologize for.
Well, next topic within the topic, I want to get to this idea of the impact of the lockdowns. We know some things about the impact of the virus itself. Of course, we continue to learn that. But you, very early on in the process, through the Great Barrington Declaration, you tried to turn the public's attention and the authorities' attention to the effect of the lockdowns. This isn't just about, are we going to save people from the virus, that there are real consequences and real choices and trade-offs from these lockdowns. Tell us more about that. What, in your estimation, does the evidence show that the lockdowns did to the general public and to the globe?
I mean, I think the lockdowns harmed nearly every single poor person on the face of the earth. And it did it in a myriad of ways, and it's because they disrupted normal social functioning. It's almost impossible to categorize or to list all of them. Like the most direct effects in the very first days of the lockdown, like take for instance in India, when they locked down, almost 500 million migrant workers were forced to walk to their home villages from the big cities where they worked. Migrant workers that lived hand to mouth, so they would buy food for the day and goods for the day to sell. From the goods they sold, they'd buy food for the next day. When they locked down, essentially their entire life savings disappeared at the stroke of a pen. 1,000 died on transit, walking back at the order of the government to lock down. In March of 2021, the UN estimated that 230,000 children had died from starvation in South Asia because of the economic dislocation caused by the lockdown. The estimate is that 80 million people worldwide have suffered from hunger and starvation as a consequence of the economic dislocation. When we have a globalized economy, you have an interconnected world. Poor countries reorganize their economies around that globalization event, and overnight it was broken. And what happened was millions of people lost their jobs, lost their ability to take care of their families, and many, many people have died as a consequence. And that's in poor countries. In rich countries, people have faced lockdown harms in the form of delayed medical care. Many women are going to come in with late-stage breast cancer that should have been picked up during 2020 when we told people to stay home instead of getting standard medical care, screening. Children who in many places around the world, especially in places like California, who essentially had a year and a half of disrupted schooling. Well, their entire lives will be disrupted by this. It's very difficult to make up such a long period of time in childhood. And good evidence from before the pandemic suggests that those kinds of disruptions play out in the lives of children, with them becoming poorer as adults, less healthy and likely to live less long. One estimate early in the pandemic suggested something on the order of 5.5 million life years lost just from the spring lockdown in the United States alone. And it's worse in other poor countries. In Uganda, for instance, I think 4.5 million children that after 2 years of missed school can't be found again. They're just not coming back to school. Yeah. It's a devastating toll these lockdowns have had, and we're going to need to work to repair the damage to the best we can. But I do not know how it's possible to repair all of it.
You talk about the impact of education. I think we're still discovering, and you mentioned there specifically in Uganda, but I think that story remains to be told here in the United States, because millions of children have left the public school system. Some have moved into other situations, but not all of them. And I think there are some who still have not, are not accounted for in many ways. Now, you mentioned there the difference between developing nations and first world countries and how that affected the population, these lockdowns. If we were to do it again, do you think that countries should respond differently based on their economic situation and their ability to handle lockdowns?
Absolutely. I think for the poor of the world and poor countries of the world, lockdown has been a devastating mistake. It has destroyed the lives of hundreds of millions of poor people. Their livelihoods, many who've died or starved as a consequence. The idea that the World Health Organization recommended lockdown to the poor countries of the world still shocks me. And I think an organization that does not understand the living circumstances of the vast majority of the world's poor, making recommendations that were guaranteed to harm them, when in fact COVID for the vast majority of them was a very low on the list of threats they face. I think the world needs to look at that very carefully and put in place advising public health authorities that have a better understanding of the living circumstances of the poor around the world.
One of the other impacts of lockdowns you mentioned there was the effect of delayed healthcare. And we know that all the hospitals were essentially told, don't do anything other than COVID, which means people weren't visiting their doctor for what might seem like less serious treatments. As a result of that, things were not being diagnosed earlier. And there was real concern that cancer diagnoses were not happening at a time when they could be treated. And now that we've had a couple of years to track this, any sense of how significant that concern was?
I mean, that was a pretty important concern. I do think there have been some good attempts to try to catch up, basically, at least in the United States, to sort of bring people back in for standard screening that didn't happen before. In other countries, it's less good. So like in the UK, there's an enormous backlog of that kind of standard screening procedures that's going to take its toll. A lot of places are seeing overwhelmed hospital systems. New Zealand, Australia are seeing overwhelmed hospital systems as COVID arrives on their shores, and you have this like backup of cases from the lockdown that happened in both of those countries. So I think it varies from country to country. I think for many of these things, we can do things to address screening recommendations and to speed things like that up. The thing that I find I think is going to be hardest to address in the United States is the psychological toll of lockdown. In July of 2020, 1 in 4 young adults, and according to a CDC survey, reportedly had considered suicide the previous month. Yeah. 1 in 4. We're seeing unprecedented levels of depression and anxiety, especially among young people. I think it's no surprise that we're seeing excess deaths from fentanyl overdoses and other drug overdoses. We're seeing a huge toll paid, especially by young people, from the psychological harms of lockdown. And that, I think, will be much more difficult to make up. But I do think that that's the right thing. The question to ask is, how do we address these problems that have been created by lockdown? We can pull our hair outs over, and we should lament the fact that we did this and resolve never to do it again. But more constructively, how do we repair some of the damage? Not all of it can be repaired, but at least some of it can, and we should work to do so.
Yeah, I think you make a great point that there is a benefit of hindsight, and we do have that now, but in some ways it is what it is, and you make mistakes and then you try to recover from those. And I think we do need to learn and not repeat the mistakes of the past, but we also have to come together and try to repair the damage. But Dr. Jay Bhattacharya, you are a voice of reason, and reason is probably the best word I'm looking for here. In all of this chaos, we've really appreciated just the counterbalance, and the way you have done this has been a a service to the country and continues to serve us as well. So thanks for your time today and your courage in saying it.
Appreciate it.